Otke Remediation Workbook, OTH 6938, Seminar 2, by Giselle Guerrero. Practice exam question. An OTR is advising a client who has had a flexor tendon repair on the timing for resuming ADLs. During what time period is the flexor tendon repair the weakest and most likely to rupture? I answered B, 4 to 9 days post-surgery. However, the correct answer is C, 10 to 12 days. A tendon repair is typically at its weakest during the 10 to 12 day post-surgery, during the fibroplasia phase in which collagen is just beginning to be laid down to strengthen the repair. Question 2. An OTR has been treating a client with a distal radius fracture. The client is independent with all ADLs and the OTR is focusing on IADL and other areas of occupation. Because the normal pain-free range of motion may not be possible after this injury, the OTR has refocused efforts on gaining pain-free range of motion within the client's functional range of motion. How would the OTR determine this client's functional range of motion? I answered C. However, the answer is A. Assist the client in identifying activities the client wants to meet or needs to be able to accomplish with the affected extremity and incorporate practice of these activities. The reason for this being that identifying activities remaining for the individual client allows the OTR to measure functional range of motion needed for these activities. Question 3. An OTR is working with a 4-year-old who is recently diagnosed with Duchenne's muscular dystrophy. The client's parents want to understand how this condition will progress and affect the child's participation in daily life. Which statement describes the progression of DMD? I answered C. However, the correct answer is D. The condition progresses quickly and children often need to use a wheelchair by age 9. The reason for this being that by age 12, children who have DMD generally will be unable to walk and will need a wheelchair. By age 20, they typically need a respirator to breathe. Question 4. An OTR is working in an inpatient unit with a child who has congenital heart defect. Before admission, the child was able to complete a basic self-care routine. Currently, despite wanting to complete the activities independently, the child requires assistance because of compromised endurance. What compensatory strategy or technique would the OTR use to minimize the impact of the condition on the child's occupational performance? I answered B. However, the answer is A, pacing activities. Children with congenital heart defects may want to be independent in play and self-care tasks. Pacing activities and selecting appropriate activities are 2 ways to promote their independence. Question 5. An OTR is working on sitting balance at the edge of the bed with a client who has had a stroke and has residual left-sided hemiplegia. The client requires minimal assistance to maintain static sitting because of lateral leaning. How can the OTR best adapt or modify this activity to improve sitting balance? I answered C. However, the correct answer is B. Allow the client to bear weight on the left forearm on a small stool. The reason for this being that weight bearing on the affected side will provide lateral support and can reduce tone. This positioning technique changes the physical demand of static sitting to improve participation in the task.